thriving practice is a relationship-centric practice. Doctor or doctors, if you have multiple doctors, and team members all believe in a relationship-driven practice. That means that we know our patients' names, we know the spouse's names, we know their kids' names, we know the dog's name, we know their hobbies, we know their interests, we know what college they went to. Maybe we know that a particular patient, let's call her Linda, is taking care of an elderly mother right now. Maybe we know that another patient, George, is going to celebrate his 25th anniversary next month. Those are the things that we know. That's what makes dentistry such a rich experience. Dentistry is a people game. A thriving practice is a patient-centric practice where everyone, doctor and team members, every ounce of their DNA, they believe it's important to develop rapport and relationship with the patients we're taking care of. And they, in turn, develop rapport and relationship with us. Rapport is the kind of the first step towards relationship. And then ultimately, rapport blossoms into a relationship.
I think this is really important, Gary, this particular pillar, because I know you have worked with tons of practices. There are those commodity practices, and the number one thing they lack is relationship, because it's all about how fast you can process the patient and go on to the next patient, right? It's all about speed. Relationship is, healthcare is very personal, and being able to have that relationship where you feel like you can trust someone who really knows you, knows your history, not just the last 30 minutes, but for years, and who takes, for who your health is important. So the doctor cares about your health. So knowing that somebody else cares about my health as much as I do, I think that's priceless. And that's why a lot of patients never leave a relationship-centric practice. Even when they move, they come back.
It's missing in so many practice models where, if the practice model is high volume, lots of turnover, it's not relationship driven. It's a commodity-based practice, and a commodity-based practice will never be a thriving practice.